folks at home, I was going to do a little bit of movement with the group.
Yep.
So can we, let me see if I can use this. So because we've been sitting, is everyone comfortable just standing for a minute? Yes, I hear a sigh. Let me know if I'm not coming through on the mic. This is a little bit of a disconnect. So if you're comfortable, and that's lovely, just placing your hands on the chair in front of you. And we talk about mindfulness, and I'm an embodiment practitioner, that there are experiences that are happening in our bodies that we tend to get disconnected from. So with all of this lovely conversation and all this information coming in through one system, I thought I would start with some movement. My intention had been to end with some movement. But if you're comfortable with your eyes closed, if you can step forward and just place your hand on night, so you know where it is, you're in time and space. And then we're most comfortable, or we're safest, if our vision and our nervous system is all sort of pointing in the same direction. So you don't need to look at me. There's nothing exciting that's going to happen out here. This is an invitation to be with yourself. So feel your feet on the ground. You can let your arms relax. If you're using the chair, that's perfect. And you want to have a nice, comfortable stance that might be a little bit wider than is your norm. And in these practices, there's an image that they use where the spine is gently suspended from above, from the crown of your head, all the way down into the ground, where it meets this idea of roots. And I like to think of them not only in the East Asian tradition being tree-like and supported, but our community roots, our DNA, our cultural roots. So as Dr. Roach said, we're not alone. And without any need to change it or fix it, regulate it, just notice your next comfortable exhale. And your next comfortable exhale. And your next comfortable exhale. Your body will inhale if we can just remember to let go. It's not magic, it's physiology, and it's powerful. Nice. And then without any need to see or grasp or understand. Sorry, thank you. Gently open your eyes. Be aware of your breath. When in doubt, exhale. When not in doubt, exhale. You can have a seat. Thank you for humoring me. I think I'll be fine now because I'll be using the slides. Thank you. Is this on? So I don't really have any conflicts. I do teach Tai Chi and Qigong outside of my role here at the hospital. I also teach it here at the hospital, and I'll have some information about that. I was primarily invited here to talk about the movement. I am also a licensed acupuncturist and have additional training in these movement therapies. Dr. Petrillo talked about moving with challenge. And so I would encourage, and we'll do a little bit of movement later, it just has to be simple, easy, and a little bit playful. These are not complex movements that we literally play with. So I have an advance on the mouse, okay. So I'll just run through some simple definitions, a minute or less of the history of traditional East Asian medicine. We'll talk about integrative therapies as I'm with the Catherine A. Gallagher Integrative Therapies Program here, and we'll have more information about that. But how these practices and the understanding of these things is now moving into and alongside conventional care. Again, very, very short current areas of research, and then we'll go back to a little bit of movement and some experiential things. So the earliest known record of Chinese medicine goes back to 500 to 200 BCE. This definition comes actually from the NIH website. Traditional East Asian medicine, often referred to as traditional Chinese medicine, but it is across the Pacific Rim. There's Korean, slight variations, and Japanese, but it is a multimodal healing system using diet, exercise, herbs, acupuncture, and relaxation, as well as the movement. I would call it relaxing movement. And it requires the active participation of the patient. And this is what we're talking about. This is something that we can engage in a partnership with. And it has always emphasized primary prevention and wellness as integral to the success of this healthcare model. Again, these practices are becoming standard care alongside conventional treatments in hospitals and community settings across the country because the state of the research supports these practices. Integrative medicine, I wanted to just distinguish between these sort of labels, is again a type of medical care that combines conventional standard medicine with complementary and alternative, or previously was regenerative therapies that have been shown to work and to be safe. Complementary, these treatments again are used alongside standard treatments, but are not considered standard of care. The integrative is when the multiple teams have established that this is falls within best practices for an institution or a practice. Alternative, which was the prior designation, maybe 15 years ago, these are treatments that are used instead of standard treatments. And this used an example of a special diet that could be used instead of anti-cancer drugs as a treatment cancer. I'm not going to get into the details of tweaking this out. I just want you to be clear about the language. Traditional East Asian medicine, there are 8 branches. So it gets confusing if you're on the web or you're looking at websites, or I always refer people to the NIH website. It's well supported in the scientific community, but it can involve diet and lifestyle, acupressure, acupuncture, and these are things to become familiar with. Or if you hear them, moxibustion, and I'll define all these, herbal prescriptions, the Tai Chi and Qigong, which are the movement therapies, breath awareness, we just did a little bit of that, very simple, and then environmental factors. When we do a differential diagnosis, we question people out, where do you live? Do you live in a damp environment? Those kinds of things. So do you live with stress? So the early reference to this diet and lifestyle back in around 600, Dr. Sun Tzu Mao said, first command the diet. And it's important. And you don't have to do anything strict, but just be aware. Acupressure is massage along the pathways of the acupuncture channels or on local points. And we do practice this here at the Cancer Center, licensed acupuncturists. It predates acupuncture, and there are different, in China they call it Tuina, we call it acupressure, shiatsu in Japan, and Cheongak in Korea. So if you see these things in print, it's reliably acupressure along the channels, or at least it should be. Acupuncture, again, stimulation of the local points along pathways of the body with a small tool, doesn't have to be a needle. And that, again, these This medicine dates back over 8,000 years ago. And at Mass General, of course, we do use needles. We use single-use sterile stainless steel needles. Moxibustion is a stimulation along the local point, same thing, with a little bit of a warming, either a warming tool or sometimes it's on the skin, but that's another story. We don't do that here at the hospital. And again, developed in northern China because of a cold environment. They didn't have central heating. How do we introduce warmth? We know blood circulates, all molecules circulate more rapidly with heat. I wanted to include this as an important area of misunderstanding and miscommunication. So Chinese herbal formulas, they're characterized by a multi-herb formula. And clinicians in most states are required to, Chinese herbalists have at least a master's degree level in East Asian medicine, and they've passed national boards. Before taking any supplements, even from a certified herbalist, you want to discuss that with your oncologist. And an individual active ingredient in these formulas may increase or lessen, have some effect on the medications you're taking. And then my department supplied this link to Sloan Kettering. And then the Qigong, which again is just more simplified movements. We played a little bit with that with the breath work just now, has a 5,000-year history. There's material evidence that goes back to 186 BC. I have a photograph of it later, this silk scroll depicting these movements. And then the Tai Chi Chuan is a choreographed sequence of some of these simple movements. Again, therapeutic movement. Someone else was talking about kindness, the captain of kindness. So we can be our own captain of kindness internally. Breath awareness, most of us don't exhale. And anxiety keeps the breath shallow and up and tight, and has this feedback system to the nervous system that, the house is on fire when it may or may not be. And then again, I mentioned the environmental influences, and that's true to be aware of. The well-wisher, was it? These can be stressful stimulus that we discount. So we just want to be aware of how that feels in our body. And again, we'll come back to that, how it feels in my body to be giving this talk right now. Teeny tiny sample of the research and resources. Tai Chi in patients with chronic heart failure, randomized controlled clinical trials. I teach in some of these trials. I taught in the pilot for that one. There's some fabulous work around how acupuncture affects the cellular activity. And Dr. Helen Langerman, who was at the Brigham and is now the director of the National Institutes for Health, what are they calling it now? The Department of Integrative Health. Again, this may be from, actually done in Charlestown, rewiring the primary somatosensory cortex. So they're looking at brain imaging and they're doing acupuncture for carpal tunnel. And they actually were able to map how someone coming in with carpal tunnel, the motor cortex that regulates that area did not have distinct digits. And over time, they were able to see it light up as distinct digits. Again, more brain mapping. This is around meditation. This is Sarah Lazar's work. She's also here at Mass General, and doing brain imaging, 12 weeks of meditation before and after, and had changes in some of the brain structures. I don't want to get into all of this, but if you're curious about this, I find it really exciting. A link to about Tai Chi and Qigong, again at the NIH site. and NIH for Chinese herbal medicine. And then there's also an online course with a book from the Harvard Medical School about Tai Chi and all of the research that supports some of these practices. That's most of the Brainiac stuff. What we offer here at the Cancer Center is acupuncture. There is a physician's referral required. We have an outpatient clinic for anyone who's ever been treated at the Cancer Center. And acupressure is usually provided in the clinical settings. As I mentioned, I teach the Tai Chi and Qigong here. We can give you more information about that if you're interested. And then the breath awareness piece is part of my classes and part of my work with staying alive and staying calm throughout my practice here. Contact information for the program, our department within the Cancer Center, Catherine Gallagher Integrative Therapies Program, and we are on the Mass General website, which will provide information about our services as well as contact information. Catherine Gallagher program at partners.org. And then our team, we have yoga, the Tai Chi and Qigong, massage therapy. These are our clinicians and our acupuncture clinicians. All right. So, as part of what we do and what we offer, for me as a leader, I'm just going to ask you to be in your own bodies. So if you're more comfortable sitting, that's fine, but I would invite you, actually, let's just do this. Let's just sit with our feet flat on the floor. And in this case, most of you should feel safe closing your eyes, letting that suspension be free and open from the ceiling down. Notice your next outgoing breath. And if you're comfortable, resting your palms on your hands. I'm sorry, your palms on your thighs. And then notice if there's anything you don't need to do around your face, your jaw, shoulders. Letting the exhale rinse through. Rinsing down through your chest and your back. So we have this tool 24/7 to exhale, to notice. So it's a nice, comfortable, upright position. Neither holding nor straining nor collapsing. Just allowing our organs to float. Allowing our spine to have a little space. Brings us back into our body, or allows our body to do what it knows how to do. Notice any sensations down in your ankles, your feet. Your toes. Good. Keeping your eyes closed at first. Notice those sensations And as you begin to come back into the room and into the sounds, only bring back what you absolutely need. And when you are ready, gently opening your eyes, coming back into the room. Good. Yeah. It's a superpower. All right. Everyone all right? Set a timer on your phone. Put a Post-it on the coffee pot. Exhale. And if you can exhale 3 times, it will just sort of start to reset things. It doesn't change the external environment, but it helps change some of the internal environment. All right. Thank you.